Good morning, greetings, student. This is me, Dr. Tiwari, and today we are going to learn about sexual and gender identity disorders. This is another important topic in psychiatry, and especially for medical and nursing students who are preparing for their competitive examinations like USMLE, PLAB, and NCLEX. I suggest you to briefly go into this video. It might be helpful for you. Well, now beginning with, let's say, in this topic we'll be learning about what is gender dysphoria, what is transgender identity, sexual, or what are different sexual dysfunction disorders. We'll just go through it briefly. Now, understanding gender dysphoria. So it's basically a situation in which the person is not having congruence. That means he is not satisfied, or he has some discomfort with his own gender identity at present, and with that with which he was born. That means if a person is born, suppose as a female or as a male, and then at birth, and then they have developed different gender identity. So if he was a boy as a child, as a baby, but at 16 years age, at 14 years age, he feels himself like a girl, and because of which there is incongruence in his personality, and that is causing him persistent distress and functional impairment in his different life domains. And if all these things has been there for more than 6 years, 6 months, then this meets the criteria for gender dysphoria. So obviously, when the person, especially young people, when they have gender dysphoria, their social functioning gets impaired. That means they start developing interpersonal relationship, romantic relationship, as well as they have difficulty developing social interaction, community engagement. Yes, and similarly, there will be problem in academic performances. And similarly, there will be occupational impact. That is they stay away from the job because of the fear of their colleagues being judgmental, and so on. So these are the functional impairment areas if a person happens to grow with gender dysphoria. So when a person is having gender dysphoria, it's our responsibility to affirm their gender domains, so that if these things are well addressed, they become more adaptable as well as more acceptable in the society, and they can live a happy life. So there needs a social affirmation, like they must be allowed to do the name changes, pronoun uses, EC, eat whatever they want. Similarly, their clothing, their presentation, everything must be accepted by the society. Similarly, there must be some easiness in changing their birth certificates, identification documents, as well as legal name changes. And similarly, they must be made available with hormonal therapy, surgical intervention, or any other intervention. If these things are well addressed to the people having gender dysphoria, then they may live a happy life in the society. Now, we'd like to know what is a difference between someone saying transgender and someone saying having gender dysphoria. So basically, in gender dysphoria, there always, as I said earlier, there must be criteria of at least 6 months, 6 months of functional impairment in different domains like educational, social, occupational domain in life. There must be impairment for more than 6 months, and there must be distress in the person, simply because there is incongruence between their gender with which they were born and the gender identity they have at now. However, transgender, it means like a person is, in this case, the person is having. So yes, transgender is more like it's more like gender identity of an individual. So let's say a person is born a female, but when he or she is growing up, she starts feeling herself as a male. Then this phase in their life is known as this, which may be transient or persistent throughout their life. This phase is called as their transgender phase, or let's say their identity as transgender identity. So basically the difference between transgender identity and gender dysphoria is that a person with a transgender identity may or may not have distress in their life as in realms of gender identity. Okay, so if a person has a transgender identity and at the same time if he or she has a stress, then they fall into gender dysphoria. But if they simply have transgender identity, that is there is some incongruence between their now identity now and gender assigned at birth, but there, since although there is incongruence, but the person is not feeling any distress because of that, then at that time we just say that this is his or her transgender identity. We don't use the word like gender dysphoria. Gender dysphoria is used only when there is a distress because of their current identity. Okay, gender identity. Well, again, yes, so again, if someone says that he or she is a transgender, it doesn't mean that he or she has a mental problem. Okay, but if he or she, irrespective of if he or she is transgender or LGBTIQ, whatever it is, then in that case, if he or she has a mental distress, then we call it as gender dysphoria. Okay, now let's go to another topic, and sexual dysfunction overview. Okay, now let's talk about what are the different types of sexual dysfunction a person can have. So basically, if a person can have sexual desire disorder, in which a person is like there are two types of sexual desire disorder, that is hypoactive sexual desire disorder and sexual aversion disorder. In hypoactive sexual desire disorder, a person is like no, I don't like, I'm not that interested in sexual feelings, I don't have that much of sexual feelings. And in sexual aversion, no, I don't like sex at all. So these are that group of people. Whereas arousal disorder is like a person has sexual desire, and when he or she is trying to initiate the sexual desire, then there, in case of male, there is erectile dysfunction, and in case of female, there is female sexual arousal disorder. Then this comes under sexual arousal disorders. Similarly, there are orgasmic disorders. Now, a person has initiated the sex, but if he or she cannot reach orgasm, then that's anorgasmia. So in case of male, again, there may be sometimes premature ejaculation, or there may be delayed ejaculation. So because of this, the person may or may not reach the climax. So we also categorize this into orgasmic disorder. Similarly, there may be sexual pain disorder, especially in females. That means while penetration, a male may feel pain in the penis region, whereas the female may feel dyspareunia, or let's say pain in the genitopelvic region. So these are another group of sexual dysfunctions. Okay, now I would like to, if a person, erectile dysfunction is quite common in the society. So if a person has an erectile dysfunction, then we want to know what are the different causes of sexual erectile dysfunction in males. Okay, so in this case, there is a mnemonic called penis. You can remember that. So penis, basically P for psychological, E for endocrine, N for neurological or neurogenic, I for insufficient blood flow, and S for substances. So when any of these things comes up in the person, then he may have erectile dysfunction. So when you say psychological, obviously when there is anxiety, depression, relationship issues, then at that time there may be erectile dysfunction. So we say the cause is psychological if while sleeping in the night the person has nocturnal erection, but while trying to do the sex with his partner, at that time he cannot maintain the erection. Then we say, oh, since he is not being having erection properly for enough time during sex, so but however while he is sleeping, the body is responding by allowing nocturnal erections. So that means the system in the body is working fine. It's just the psychological thing that is preventing the proper erection during the sex. So it's more like psychological erectile dysfunction, and it's quite common. Now we say next is endocrine causes. So if the person has diabetes mellitus, hypogonadism, low testosterone, thyroid disorders, then at that time also erectile dysfunction may occur. Similarly, neurogenic cause, if there is spinal cord injury, there is post-operative complications if the arteries or the nerves are cut, and similarly there's diabetic neuropathy, then this can lead to erectile dysfunction. Similarly, if there is insufficient blood flow through the arteries, peripheral vascular disease, hypertension, then this can also lead to decreased blood flow in the blood vessels going through the penis, and as a result of that there won't be erection properly, so we call that erectile dysfunction. And similarly, when the person is taking different recreational drugs, is taking antidepressants like SSRIs, and is taking antihypertensive, okay, like spironolactone, or is taking alcohol, then in all these cases also there may be erectile dysfunction. Now clinical takeaways is like gender dysphoria. Gender dysphoria must always have distress. Okay, the person must have distress to call this gender dysphoria, and in this phase there in different life domains there will be the problem. So we have to support these people with affirming care as much as possible. And yes, we also read about what are the different causes for sexual dysfunction, especially erectile dysfunction in case of males. So this was it. So I hope you understand this topic, and if you have any questions you can comment down, or you can do your own research too. I hope this was quite helpful to you, and please like, share, subscribe, and we will meet in the next video. Okay, bye bye, take care.